gossiping or something. I'm coming. I'm nattering on.
Okay, thank you. So welcome to this meeting of the Healthcare Wellbeing Scrutiny Committee being held on Friday, 25th November 2022. Fire and emergency evacuation for those present in the meeting room. If the fire alarm sounds, please leave the building by the nearest exit and make your way to the fire assembly point in the car park. The agenda papers and other relevant information for this meeting are available for public viewing on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and making a recording. To ensure that recording quality is maintained, please speak as clearly as possible, keep background noise to a minimum. Please ensure that mobile phones and other devices are turned silent. There is permission to film and photograph, but we don't have any members of the public present, so I don't think we need to go into that. Only committee members present in the meeting room may vote. And we have a number of people in attendance as virtual participants. Can I request that they use the raise hand function within the system if they wish to contribute and to introduce themselves when they are called upon. You may notice as well that we have we're wearing white ribbons today, which is ending violence against women and girls, which obviously is something very worthwhile. So moving right along, agenda item number 1, apologies for absence. Apologies for absence have been received from Councillor Gandy. Are there any other apologies? Because we're all here. Name substitute, Councillor Helen Ironson is substituting for Councillor Carol Gandy, cannot be present in the meeting room, therefore Councillor Ironson will be able to participate but not vote in the agenda items. Welcome, Councillor Ironson. Declarations of interest. Do any members wish to declare any interest in any agenda items? No. Okay.
What about being on the task and finish group? Is that?
No, that sort of goes with the territory. It's understood, but thank you, Councillor Summers.
I need to just declare my connections to various agricultural bodies.
Okay.
And the fact that I chair the government's animal welfare committee.
Thank you. Anyone? Good, thank you. So minutes. The minutes of the meeting held on the 23rd of September is included in the agenda at pages 9 to 20 for approval. No matters of accuracy have been notified to the monitoring officer. Are you content that I sign the minutes as an accurate record? Please show. Thank you. Agenda item number 5, questions from members of the public. No questions have been received from members of the public on this occasion. Agenda item number 6, questions from members of the council. No questions have been received from councillors. Agenda item number 7, the progress report. So I'm going to invite Michael Carr, Statutory Scrutiny Officer, that's quite a tongue twist, wasn't it? To introduce the progress report, please. Thank you.
Thank you, Chair. This is a brief update information item on the progress of matters considered at the last meeting. So at the last meeting, you will recall, the committee considered obesity in Herefordshire, and at the end of its deliberations came up with 15 recommendations to the Cabinet. These were referred to the Cabinet and were notified at Cabinet meeting yesterday. The Chair of the committee presented them to Cabinet. The Cabinet have been asked to provide an executive response with decisions on those recommendations within 2 months. So, and that's pretty well everything from last meeting.
Great, thank you. Do committee members have any questions or comments on the progress report? No, thank you. We don't have the Cabinet member present. Council officers, do you have any comments at this point? No, thank you. So the covering report recommends that the progress report on scrutiny information requests, scrutiny reports and recommendations and other matters raised by the committee be noted. So can I please have a proposer and seconder for the motion? So proposer is Kevin, seconder Councillor Summers. All in favour, please show. That's unanimous. Thank you. Agenda item number 8. Which is the Healthcare Wellbeing Scrutiny Committee work plan. which is to note the work plan for the committee. So I'm going to invite Michael Carr again, who is the statutory scrutiny officer, to introduce the item, please.
Thank you, Chair. Again, this is just an information item for your consideration. It's the work programme of the committee, already agreed by the committee, as yet unchanged for your review.
I'm just going to pick up on the in the bullet point 4 that we had looked previously at the position regarding the minor injury units, and that seems to, I think we need to get that back on the horizon, because I certainly would want some reassurance and clarity from the trust as to what their intention is and where we are with that. And I think other members who have put quite a lot of effort into that scrutiny would also like to know. I believe, Mr. Bohr, you're currently sort of trying to mine out where we were with that dialogue, and then we'll pick up from there, and then potentially put this on the work programme at the next meeting. Not for the next meeting, but in the next meeting, actually determine whether or not we need it back on the work programme. Is that?
Yes, Joe. I mean, what I was going to suggest is perhaps if we seek a written update, that that's published with the minutes, so that at least we've got that on record as to what the current position is, and then we can take that from there in terms of any future work programme items that we might want to come in for. Actually, Jane Ives from Wye Valley Trust actually is just coming in, joining the call now, so just let her in.
Okay.
But
We've
lost her. But Hilary Hall has a hand raised as well.
Okay. Yeah. So, Hilary.
Thank you, Chair. We have had some conversations with Jane Ives, and I know that she was very open to coming and talking to members. But perhaps if she is joining the call, then that's one thing. But we can certainly do a written briefing and then potentially invite her, depending on the outcome of that.
Yeah, I think that would be the first step, and then the committee will want to determine what the next step is, I think. So, Councillor Tillett.
Chair, I mean, from memory, I thought we pushed this a bit further, and that was there not a motion in for council to refer this to the Secretary of State, and I'm not aware that we've ever had any feedback from the several Secretaries of State that no doubt we've had in the time since then and now, but it can't just get lost in the ether, can it?
No, absolutely. Quite right. So I think that was something that we took very seriously. We did have concerns over it. So I think we require a follow up at this point. Jane Ives has come onto the call. Hello. We're just having a chat about the MIU situation, which we had scrutinised previously, you may recall, and we're considering revisiting it. But in the interim, we'd certainly like a briefing note or an update over it.
Are we on the minor injuries?
Yes. Yeah, minor injuries units. Yeah. So, do you need to unmute?
Hey.
Yes, sorry, I hadn't expected that to be on the agenda, so I haven't come.
No, it's only because we're talking about the work programme, so it's horizon scanning.
That's that's absolutely fine. I did meet with Pauline Crockett recently and gave her a briefing. I mean, I'm very happy to come back with a more formal briefing, but equally very happy to brief a number of people outside of the meeting if that would be helpful.
I think my feeling then, having to be guided by the committee, would be to have a written note in the first place, and then potentially what we'll do is have it as a sort of an element in the work programme, depending what the written note tells us. I think it's probably where we want to go. Councillor Summers.
I have a question. When was it discussed with the cabinet member? How long ago was it discussed with the cabinet member? And I'm rather surprised that it hasn't come any past the cabinet member yet. If it's a briefing of some sorts.
Well, Sorry, Jane, go ahead.
Go ahead.
Just to be, it was just I was sort of asked a question, and so I was so I had a meeting with Hilary and Pauline just to give sort of a where we were, and so we had that about 3 weeks ago, maybe, Hilary.
Okay, I'm just concerned that these briefings go on with cabinet members, etc., and they seem to get lost in the ether, and I'm not happy about it. This is an ongoing issue where things are discussed with cabinet members, etc., and they don't go any further than that. Now, there's 53 members, not 8, and I think that we should all have some input in what's going on. Thank you.
Thank you, Councillor Thomas. Councillor Jim?
Yeah, I just think I'd better come in on that, because I think there's a little bit of a misunderstanding of the role of Cabinet. It's quite regular, there's going to be briefings on all sorts of things, and you would expect the Cabinet member to get regular briefings. That doesn't mean that it always turns up in any broader context, but it should be that they're on top of the job, which means they've got constant briefings. They're not going to then brief every time to the whole of council. But if you wish to ask them a question, they should be in that position, and therefore if we wish to bring a cabinet member in here in front of us and ask them about particular aspects, then that's what we should be doing in scrutiny. Fundamentally, they're not going to report every single thing they do, because every day they're having meetings and briefings, and I think there is a limitation of expectation there as to what is reasonable, what filters out, what filters down. It's up to us at scrutiny to ask the questions of them and bring them here to give us evidence.
Thank you.
If I can just slightly play devil's advocate, in the sense that I completely agree with Councillor Jimman. However, the MIU is not just an everyday yet another thing to be briefed on. It is something that has exercised this committee a number of times over the last few years, and indeed predating Councillor Jimman's time here, but has also been brought to full council. So I would have hoped that the cabinet member would have recognised that it was not a standard everyday briefing, and maybe it was something that could have been fed back to us with an element of urgency.
No, I think that, well,
But why don't we make a specific request that we get something back?
that's
That would seem to me to be a not unreasonable thing to do. But as I say, I don't imagine that if she holds a regular meeting with with Jane Ives, I don't expect that every week we're going to get the same thing. I think it's a case of a composite, which probably should go into the leaders' briefing as well. Yeah. That would seem to be a logical place to put it.
Can I just
react?
I just want to react
here because we have got business to.
I know, but I just want to react to that, because this wasn't about everything coming out to us or to members. But if it's already being being talked about and we've asked questions on it, then we need to have the information. We shouldn't have to go chasing it again.
Yes,
that's all I'm saying.
I mean, to be fair, we're not chasing it. Councillor Crockett raised a concern with Jane Ives. She also told me that she was doing that, and that made me think, yes, okay, no, we need to do that too. Now, would it be nice if the approach had been proactive from the point of view of somebody saying, well, you looked at this previously, here's the update. So to that extent, we have to chase. But I don't think there's a reluctance on the part of the trust to give us the briefing or to provide the information that we're requesting. And then if we want to look further into it, that will be at our discretion at some point in the work programme. So I don't think there's anything untoward about that. Okay, thank you. Thanks to Jane Ives. There are one or two other notes around the work programme, including, for instance, a request for a briefing note on dementia provisioning. And is our understanding that would sit alongside the agenda item on domiciliary and residential care? That sort of seems to me to be quite a logical connection, if we're all happy with that. Yeah. Yeah.
So I'm just asking through the chair if we can ask an immediate question of Jane as we've got her, and I'm sure she will be here for a period of time, and time's valuable. Jane, obviously we're all aware that we're going to have a nurses' strike. we really do want to understand what the impact that might have on residents in Herefordshire, and it might be sensible just to have a comment from you with regard to your planning, which I'm no doubt you've been doing, but I think it would be an opportunity now just to hear a few words on that one.
So for Wye Valley Trust, so there's only the RCN ballot that so far has reported. There are a number of other union ballots that are going to be coming out over the next few weeks, but only the RCN has so far completed their ballot. And the way this works is actually by employer, so it's by trust. So although the RCN have a sort of a national mandate, it's enacted by trust. And there are two thresholds that need to be reached for strike action to be taken, or any industrial action to be taken. The first is that 50% of the union members have to vote, and the second is 40% of all of the union members have to vote for action. On both of those thresholds, the RCN members at Wye Valley Trust didn't reach the threshold, so there won't be industrial action in the trust for the 15th and 20th of December has been announced this morning. I'd say it was very close. I think it was 48 point something percent took part, and it was 39 point something percent. So, but both of those thresholds have to be met, and neither of them were. That isn't the case around us locally. So Worcester Acute and the Health and Care Trust, RCN members have both voted for strike action. So obviously for our mental health services in the county provided the Health and Care Trust, they may be affected. So there is broader planning across the ICS around this, but the initial action won't involve Wye Valley Trust services.
So thank you very much. That's really useful to understand what's happening locally. We all have considerable concern to ensure the well-being of the population, but also of those who dedicate their lives to our care. So this is not a good situation. It's one where we have considerable sympathies with all involved. I'm pleased to hear that locally we will have services still being continued. Thank you very much.
Anyone's coming? Councillor?
No.
Okay. No, I'm just going to pick up on any of those other points. I don't think so. Okay, so does anyone, any officers? We still don't have a cabinet member with us, do we? Any further comments on the work programme? So the recommendation is that, subject to any further updates made by the committee, the work plan for the committee be noted. I'm going to have a proposer and a seconder for the motion, please. Councillor Tillett and the seconder. Councillor Ginman, and all in favour, please show.
So that was,
Price, all in favour?
that was with, didn't it, Chair? Started in.
Yes.
Yeah. Okay, good. So we're moving on to agenda item number 9, health and wellbeing strategy, which is to present to the committee a review of the development of the Herefordshire health and wellbeing strategy, with firstly an assessment of the overall impacts and any learning points from the existing strategy, and then secondly to inform the committee of the progress and timelines of the new draft Herefordshire health and wellbeing strategy. We don't have a cabinet member with us at the moment, just the online sheet. Therefore, I'm probably going to ask if Mr. Pearce wants to just do a brief introduction to this item.
Thank you, Chair. So Matt Pearce, Director of Public Health. So the report set out in front of you just summarises. There's two parts to this paper. The first part is talking about the previous health and wellbeing strategy for Herefordshire, the work to review the impact of that such strategy, and the second part is to look at the current process in terms of developing the new joint health and wellbeing strategy for Herefordshire. you all might know, and you will have read, is the Health and Social Care Act requires every local authority to develop a health and wellbeing strategy, and this should be a fundamental document that actually sets out what the key priorities are for Herefordshire in terms of the health and wellbeing needs, and that should be informed by the Joint Strategic Needs Assessment. I won't go into too much detail. I think that the overall summary of the report suggests that actually the impact of the health and wellbeing strategy, the existing one, has been quite challenging to understand what that impact has been and the overall governance for the delivery of that strategy. And within that paper, there is some findings that we've identified that should go on and inform the new health and wellbeing strategy. In terms of the current strategy, we're out for consultation at this moment in time, which closes on the 11th of December. There's a number of priorities within that strategy. It's very much an iterative process at this moment in time, but the aim is to have that strategy ready for publication later into early spring. It's worth noting I'm joined by David Mahaffey from the Integrated Care Board today, and one of the emerging things coming out of the NHS changes is there's a requirement for an integrated care strategy to be produced for every system. And there's a lot of work going on to develop that integrated care strategy. David might want to talk more about that in a minute and how that interfaces with the local health and wellbeing strategy that we're developing too. So I won't talk any more than that. David wants to say a few things. We'll perhaps come back to that later.
No, I think I've got that to David now, if that's okay.
Yeah, excuse me. Thanks, Matt mentioned the Health and Social Care Act 2012. There's also the Health and Care Act 2022, which is what created the need for the integrated care strategy. Part of the Health and Care Act 2022 requires the Integrated Care Board and the two upper tier local authorities in the integrated care system area, which is Herefordshire and Worcestershire, to form a joint committee to oversee the production of a strategy for the whole area. So it's very much a joint council and NHS strategy, focusing on four key aspects. The first one about improving population health outcomes, second one about reducing health inequalities, third one about improving value for money in the delivery of services, and the fourth one about ensuring that we contribute to economic and social wellbeing of the population. So what you'll sense there is there are some overlaps with health and wellbeing strategies. I think that's recognised nationally. So the approach that we've taken locally is to start with the two health and wellbeing strategies that we have in our two counties and build up from those. And anything that's described in the Health and Care Act 2022 that's not addressed in the Health and Wellbeing strategy, we'll build that into the document. So there'll be a lot of consistency, a lot of overlap between the two documents. Unfortunately, they are two statutory documents. You know, that we don't have a choice. We don't choose to produce one and not the other. We do have to produce both. But I mean, as you can see, Matt and I have been working incredibly closely together for the last 6 months or so, both because I'm a member of the Health and Wellbeing Board contributing to the Health and Wellbeing strategy, and Matt as a member of the kind of strategic group helping to create the integrated care strategy. So you will see two strategies coming together over the coming few months. There's a third document that's required as well, just to add a little bit of confusion to the matter, unfortunately, called a joint forward plan, which is essentially the NHS's contribution to the delivery of both the health and wellbeing strategy and the integrated care strategy. So it's much more of a detailed delivery plan. And it's expected that in the statutory guidance that comes out next week, that health and wellbeing boards will be asked to have a role in signing that off as well. So it's likely that we'll go through the health and wellbeing board process and possibly the health overview scrutiny process as well as part of that sign off. So integrated care strategy, health and wellbeing strategy, and a joint forward plan, the three big strategic long-term documents we produce. So apologies for any confusion that may.
I'm definitely. It's a lot of plans. Okay, that's great. Thanks very much. So yeah, I mean, the most obvious thing looking at the papers was the desperate need for monitoring, a kind of monitoring, analysis, assessment of the effectiveness, implementation effectiveness of any plan, and that just appears not to have happened. And so that would be my Yeah, I think we'll all caught that one.
Yeah,
And I think we would, it's
45
probably
does not
unnecessarily,
make
but we
the
would say that was a bit of recommendation to make sure that element is robust. That you know, that has to be KPIs, there have to be KPIs that work. And also actually a monitoring and reporting system, so that you don't sort of do something and then, you know, at the end of the plan, look at it. It needs to be have that built in, you know, every how many months or whatever. So I think that would be something that we would all agree as a recommendation. So I think that's my start. So I'm going to Councillor Marsh.
Yes, I've got two questions. One's a nice, easy one, and one is a more existential. So we'll start with the easy one. So the ICS are going to have a lovely joint forward plan about how they'll deliver their ICS. So are we going to have something else about how we deliver our health and well-being? I don't quite understand whether the health thing feeds into the ICS thing, which feeds... Anyway, where will our delivery strategy be?
I'll try and answer that, and David might want to come in. So I think the health and wellbeing strategy is very much, it's a strategy for place. A place, what we mean by place is Herefordshire. So we have the health and wellbeing board, we have that existing statutory function, we have partners coming together, and actually there's not many forums where that happens, you know, some really key partners coming together. So the health and wellbeing strategy, so we're looking to identify what the priorities are for our area. At the same time, the integrated care strategy is that kind of umbrella approach, I think, across both Worcestershire and Herefordshire. And I think, and David, correct me if I'm wrong, I think that will potentially pick up any gaps or issues that maybe aren't covered in our existing health and wellbeing strategy, and something that might be able to be delivered at place. So I think the health and wellbeing strategy very much is that document that delivers the health and wellbeing needs, addresses the health and wellbeing needs in Herefordshire. And that's obviously what we're developing.
So we both a strategy and a delivery plan.
Yeah, going forwards, I think one of the clear, I think, considerations coming from reviewing the existing strategy, it was developed, it was a relatively good strategy. I think there was a lot in it, if I'm being honest. I think one of the challenges we've had is that organisational memory, and also that system leadership. There's been quite a lot of directors of public health and changes within the public health team over the years. And I think maybe that some of that's been lost in terms of when that strategy was developed. In theory, you should have a delivery plan which sits beneath that delivery plan, and there's clear accountability within a governance structure of who delivers on those priorities. And where I've worked previously, that's exactly what happens. You have your strategy, sets out the high-level priorities. Those priorities then allocated to a partnership group or governance group that has specific oversight. They have a delivery plan, and then they feed regularly back to the Health and Wellbeing Board about how they're going to deliver against those priorities. So something we also want to think about is actually what does that governance look like for the Health and Wellbeing Board? What are those partnership groups that sit underneath the Health and Wellbeing Board? And whatever our priorities might be, so for example, if it is the best start in life, who's actually going to lead on that? And it's really difficult because these issues, like we talked about obesity a long time ago, they cross-cut many different partnership groups and subgroups, but there has to be accountability somewhere. The best start in life, for example, we're reconvening the Children and Young People Partnership next Monday. That hasn't met for a couple of years. So in practice, that would be an ideal group, I think, to lead on that priority. That's what Health and Wellbeing Board choose. But yeah, absolutely, governance, delivery plans, and actually the approach we're taking for this health and wellbeing strategy, by March, April, when we have the final strategy, the next step will be those delivery plans. Once we know the priorities are, and we want to co-produce those with the community, so we actually go out to the partnership groups, go out to the community saying, right, you said these are really important issues, you said these are the kind of things that need to be addressed. What is the how and the what? And I think that's kind of what was missing from the last strategy, and that's what we need to take forward. We don't want another strategy that just sits there. We need to make change happen on the ground, and I think we probably all want that.
So my second more existential question is about page 47, where there's the lovely dull green and whitehead model of health determinants. And as we can see, healthcare services are one of 7 determinants. And personally, I would now add in a functioning biosphere. So let's say it's one of 8 determinants. So also I just think, how on earth do we think this can possibly work? You know, we're trying to waggle the happiness and healthiness of the whole population from just inside healthcare. No wonder it doesn't work. We're in the middle of an appalling recession. We have the lowest wages, and I'm trying I'm struggling to strike a balance between going, yes, we must be rigorous and have accountability, going, like what, you know? And I vacillate between the two, because quite clearly our lovely strategy, however nice, cannot on its own pull the, no, it can't. I just wondered if you had any sharing thoughts on this matter, someone who has to do it 5 days a week rather than now and then.
It's a really good challenge, isn't it? And I think, you know, health and wellbeing boards, some do struggle across the country because you're bringing partners together. There's not necessarily an additional resource. There's that kind of system leadership. So actually, how do we work more effectively together? From a public health perspective, we know that the determinants of health lie primarily outside of the NHS. We know that. So job, housing, the built environment, all those things, you know, they fundamentally influence how we live our health and wellbeing. So we need to strike a balance about how we influence those determinants of health, and that's really within our local authority. That's why, you know, we talked about obesity, didn't we, about active travel, talked about food policy and things like that, but really important. The other things to recognise, actually, there's some really good strategies already in place that are delivering on some key priorities. So climate change, there's an economic development strategy being developed as well. So actually, so we're not going to sit with the health and wellbeing strategy, but how can we hold account all these other strategies that are in place? And actually, we can influence and make sure that health and wellbeing is kind of sprinkled within it. It's not an easy approach, I must admit. And some of the conversations we need having as a health and wellbeing board is actually, do we just want to focus on maybe 2 or 3 things over a certain period of time and really focus our efforts on those things more than others? And maybe we rotate that over a 2 to 3 year period. But again, that's all to be discussed, I think, over the kind of formulation of that new strategy. So I'm not sure I directly answered your question. I would try to.
So I'm just going to pause a moment, welcome Councillor Coppett to the meeting. Councillor Smith.
Thank you, Chair. Just going on the Health and Wellbeing Board, we've had issues in the past. We don't want to stay in the past, so let's look at the future and the present. And can you tell me if the Health and Wellbeing Board is now meeting its mandates and obligations? Whatever they are, because I know they're complex, but I don't get a lot of feedback from the board, never have. I was hoping that we'd get more this year than we're getting. I'm not sure how we can go about that. Any suggestions?
I mean, I'm only 9 months in, but my sense is we are fulfilling our obligations. And the main obligations is partners working together to address the needs of the community. Obviously, there have been challenges of the last health and wellbeing strategy. There's a requirement for us to complete joint strategic needs assessments regularly. We do that every 3 years in a summary format, and we have a comprehensive Understanding Health Herefordshire website. And then the other one is around pharmaceutical needs assessments, which we just completed. So that's the kind of key statutory requirements for. My understanding are we are fulfilling that. In terms of how the Health and Wellbeing Board has operated in the past, I'm probably not best placed to speak on that. But I think there is a recognition it maybe might not have been as effective as it maybe wanted to be. My understanding is that actually there is some partners engagement and we're all committed, and that's something I've understood over the last few months. So I think the Health and Wellbeing strategy in a way gives it a bit of a springboard to, let's say, okay, you know, we are going to have some real difficult challenges over the next 2 years. I think we need to be honest about that. You know, in terms of the economic position, health inequality might potentially widen. So there's never been a more important time to come together. Plus, obviously, we're just coming at the back end of a COVID pandemic. So I think in a way, I think partners are quite galvanised and we all want to make a difference. I think it's just working through how we do that in an effective way. I don't think we've quite cracked that, but I think we're all keen and enthusiastic and want to work together. For me, that's probably the most important thing. It's just how we actually make it work.
Well, thanks, man. I'm glad to hear that you're aware of the issues and you're going in the right direction. Thank you.
Thank you. I have Councillor Ironson have a hand up on the virtual call.
Yes, thank you, Chair. Can you hear me?
Yep.
Yep. Thank you. Sorry if I'm going slightly off piste here, but I'm looking at the table 1 of the summary of improvements. Coming from children's point of view, we've never heard of the Solihull project or whatever, or And it's the first I know that the Children and Young People's Partnership are convening next Monday. It's very unjoined up, the connection, and you know, we should be getting more information, shouldn't we, as children's scrutiny?
Well, I think that would be something for Councillor Howells to take up, so it might be worth you asking that scrutiny committee to ask for briefing note, also how parenting programme and anything else that you need to know about. But,
Yes.
It's a fair challenge.
Yeah, thank you. This is very, very interesting for me. Thank you. Sorry to interrupt.
No, not interrupt. You did interrupt. Yes, Councillor Chibnall.
Yes, thank you. I think table one has probably caught all of our attentions. I think we might as well, let's be honest about it, that when you look at a set of KPIs, you you've been very honest, you put down what's happened to the KPIs. Most people have moved the KPIs, I think, to have managed to match it, but it doesn't. And it does tend to say that the previous strategy has fundamentally not done a very good job. But what I did note in this, and I think it's, again, I do take the comment that Councillor Sun's just made, that we've got to look forwards, that it says that they noted that likely to be issues with some of the indicators identified as data were not available. Now, that begs the question, if you've got KPIs but you haven't got the data that's available to actually match them, then there's something wrong in the original strategy, that if you can't measure it, you can't manage it, is an old adage. And it seems to me that it's rather strange to actually have a statement that you haven't got available data, and yet you've got KPIs that are there. So I think the lesson, if you like, for the next strategies is to make sure that we actually have measurable and meaningful, I might add, KPIs, and that we have the data that can match those. It also, and I'm very pleased to hear the comment in response to a question just now, there is a life of strategies that seems to live all on their own. They keep having strategies. Strategies no use unless you've got an implementation plan. And if you haven't got, and you need to be monitoring the implementation plan. And I think that would be something which I would hope as a committee here, we would want regular reports on. And therefore we need things that are measurable that we can understand against that, so that we can see whatever those strategies, and thank you for the fact that we've now got 3 of them that have got to be put together, makes it even more complicated.
Two strategies and one plan.
Well, one plan, but your one man's plan is another man's strategy, I think.
If it walks like a duck.
I was going to say, I think we are aware of language here. What we're saying is we want to see outcomes. We want measurable outcomes. We want iceberg indicators that will tell us that things are actually doing what they're supposed to be doing. And I think one of the messages that should be going from us to whoever's putting this, what are the iceberg indicators? Can you measure them? Can we know what the parameters are so that we know what the expectations around those are? So we've got something that we can get our teeth into to understand it's working or it's not. It's not just chat, it's action.
Do you mind if I just come back on specifically that point? Because I agree with everything you said, actually. And the joint forward plan is exactly what you've just described. It is very specific, measurable indicators over a 5-year period with clear trajectories that will drive specific actions to address those, achieve those. So there will be things like reduction, from the NHS perspective, reduction of long waits for elective care, reduction in long waits for cancer diagnosis. It will be about improving access to primary care appointments. It will be about reducing ambulance handover delays. You know, very, very specific measures that are very clearly aligned to those outcomes about improving population health and reducing health inequalities. So what you've asked for there is what will come in a joint forward plan. So hopefully that.
Valid point. In the table, I think we need to be clear, the KPIs are actually linked to the fingertips outcomes framework, which is the public health outcomes framework. So those are high level outcomes that were identified within the health and wellbeing strategy, so reducing levels of obesity, reducing self-harm in children. I think some of the challenges with these indicators, they do take some time to turn around. They are longer term outcomes. And obviously we've had the COVID-19 pandemic, and some of those outcomes also, they're stopped, they are outside of our control, so actually nationally collected. But you make an absolutely valid point, and what we're looking to develop is an outcomes framework very similar to what David said. What is your end point, what are the outcomes, what are the KPIs? We call it a logic model in public health, or theory of change. So again, I get what you're saying. The other point I wanted to make though is actually there has been some really good things that have taken place over the 5 years, and I think it's quite easy to sit here and criticise a strategy. There's been lots of good things that have gone on irrespective of the strategy. Talk community being one of them. So Solihull programme. There's some really good things. I don't want this to come across that actually nothing's happened. There has been some really good things across the whole spectrum of health and wellbeing, partners working together, but it might not necessarily be driven by the health and wellbeing strategy. I think I just wanted to make that point because, like I said, some really good assets and good things going on.
Thank you. I take your point completely. The summary of achievement against priorities is what the heading on that table is.
Yeah.
So those were deemed the priorities, and anybody looking at that at the outset would say, followed without your added explanation, not met the KPIs consistently through that. So were the KPIs wrong? Was it that the expectation is wrong? Is it outside of your control, which you quite rightly said, in which case we do need to make sure that we understand what's within our control as a council and an area, as against that which is undoubtedly outside of it and where we should be applying lobby. So I think getting clarity, we can rail against major government decisions, don't do it. What happens is here, what happens to our residents in our wards, in our area, over which we have control, and understanding that, I think, is fundamental in these any strategy.
I mean, for me, looking at table one, it is important, I think, to understand what this tells us. It tells us that there was a strategy. It tells us that there were significant actions that took place. And it tells us that there was no way of monitoring the impact of those actions. So when you get to we've done this thing, and you say, how did that go? Don't know. Because we didn't have an outcomes framework that works within the timescale of the strategy. That's how I would understand that. And so therefore you can't, clearly it's essential what you're proposing, an outcomes framework, in order to fit alongside the time frame of the strategy, so that you can see the efficacy of whatever it is that's in the strategy coming through. That makes sense, and I think that should solve that problem. Although I have to say there are things that it's alarming to have as an achievement that you've written another strategy, the learning disability strategy. Well, again, that's like, what did that deliver? And we need to not do that, because enough strategies. And actually talking about strategies and plans and all the rest of it, that it seems to me we were discussing the obesity strategy, and it's understanding the relationship of delivery plans and action plans to strategies and different strategies, because this is a highly partnershiped area, that there are different plans and strategies within the trust and different plans and strategies. So we need to kind of, for me, I'd appreciate some kind of map of how this all works, so that you know that for every strategy or every high level undertaking, there are delivery, implementation, monitoring and assessment, that we have, everything can track through, rather than we've had this great idea and then we don't know. But it is equally, I think, important, I think we pick up the point that Councillor Ginman's making, that you do not put in a high level strategy something for which we have no levers. It's just like saying, well, we want world peace. Well, okay, how's that going to happen? It needs to be on a scale that's achievable, that's doable, and indeed that's relevant to health, and not just world peace or, everyone wants to be happy. And just a sort of general kind of philosophical point, a little bit pick up, I think, on the existential crisis of Councillor Marsh, that there has to be a degree of balance between what the local government or the ICB or whatever, what they can do and what the individual must do as well. And one of my favourite things that we do is a strengths-based approach. So this is about resilience. It's about enabling people. And I think that if the heart of your strategy is that we will do everything for everyone to make them happy and give them the house and a great job and world peace, then you are doomed to fail, because there is always basically that irritating business of free will, you know, so, and it's not our job, actually. So I think that's kind of scaling some of the ambitions within any strategy to be appropriate and achievable, seems to me to be. So there are one or two things in the 12 points that I'm kind of thinking, I'm not sure really whether that's at the scale that it would need to be, in my head. So we're going to ensure fair employment for all. How's that going to happen then? How are we going to do that? I don't know. So, and small things like people can live in and work in sustainable, well, I'm sure they can, but some of them maybe will, some of them maybe won't. And either way, can we ensure that? So it's the balance, because in a sense, if the language suggests that this is something we will do, as opposed to the language suggesting that we will, you know, be seeking to support that, or you know, then it's like it's a bit misleading. I don't know, somehow. But it's how does that all reduce our carbon footprint, and you know, I'm not sure how that's all going to be delivered. So, but yeah, carry on.
I mean, David might come in to say the same thing, because back to your strategy question. So we are mapping strategies, and the ICS are doing this too, about what, and I mentioned this earlier about economic strategy, housing strategy, you know, so what are these existing strategies going to deliver against these priorities? In terms of, you know, your comment about good work for all or employment, you know, we know there's a difference between the employment rate with those with learning disability and severe mental illness compared to the general employment rate for the general population. So if that's a key priority for us as Herefordshire, what are the programmes we could put in place? And I think that's what's trying to.
But that needs to be expressed differently.
Pardon?
That would need to be expressed differently.
I think it is at the moment, it's very high level for the strategy, and that's where it comes back to, okay, this is the overarching outcomes that we want to improve, then what are the things we're going to do beneath it? What does the evidence say that we can do to make a difference to those certain areas? What's effective, what's good practice? I think that's probably the next phase in terms of developing those ideas and deliveries. At the moment, it's just what are the outcomes we want to change the population, what are the needs, what are the issues, and then what's the evidence that actually we can do to make a difference.
Yeah, and also I would like to see it as being, you know, evidence-led, need-based evidence-led, and not just because someone thinks it would be a nice thing. Councillor Summers?
Thank you, Chair. From reading over table 1, it's not really surprising that council's been in a state of turmoil and flux for a good year and a half, perhaps 2 years. So I would kind of expect this. I did note that children is improving, well as everything else is just the opposite, and possibly obviously why there's been more action. So that would, to me, would tell me that the other ones need action. So my question is do we have actions in place or possible actions in place? And what I would like to see, quite frankly, I think because of the newness of the department again and the people just coming in, and it is an ongoing issue, I'd like to see back in about 3 months, and I'm sure we put on the work schedule to see how they're getting into the whole matter of it, rather than and then give us an answer, because they have to look into what was going on in the past, see if they can improve it, as far as I can see. And I would like to have them back in about 3 months to go over that and see where you are now. So I think we have to be fairly lenient with everyone right now, because I say where the action has taken place, and that's in children's, there are some improvements. Other than that, we don't see any improvements, and that's possibly because there's been no actions, because it's not been on the it hasn't been highlighted. So my feeling is coming back in perhaps 3 months to 4 months and going through this again and hoping to see better figures. That's all. Thank you.
There is a timeline for the actual plan coming forward, so we could ask for the plan to come back when it's in a more advanced draft.
I don't think it's
stage, along with that insight into.
I don't think we're being fair right now, quite honestly, because And this is going to happen more and more in the council as we go through different committees. Because there's so many new people coming on board, they can't be expected to jump right in and run. They have to go back and see what was going on before and then hope to try and correct, or if not, okay? So I think we are being a little unfair. I think a lot of this is going to show up in the future, and we need to be looking at that in the future. Thank you.
Councillor Jim?
If you look at Appendix 2, and it says the summary of areas of concern informed by public health outcomes, that is a fantastic list of what's the status. What I want is a column to the right of that says what the target is.
Yeah.
Because that's telling me, and I don't know, whether those figures, you're saying they're concerned, so should infant mortality rate of 6.4 per 1,000 for the county, what's your target then? And that surely should be the sort of KPI that would be measurable, that we could then say, well, actually, we've now reached the national average. It might be that it's 4.0, but there must be the fact that you're actually recording this data, you've got it. It gives you the basis to say, what's the expectation? What's the period of time that you would expect it to move over? I mean, I'm not expecting 30.9% of adults classified as obese to, in 3 months' time, to have dramatically altered. There's got to be a reasonable target expectation. But those seem to me incredibly useful KPIs that we could then say, we need to concentrate on this bit because it hasn't moved, and yet you as the experts are telling us, really, it's unacceptable.
We do need comparisons to that consensus of benchmarking.
Absolutely, there will be an outcomes framework that's attached to both of these strategies because, as I say, the overlap between the two, we'll have a kind of a broad outcomes framework. Infant mortality is a very good example. There is no reason in the world why Herefordshire or Worcestershire should be worse than the national average for infant mortality. We should be better than the national average, and we're not. National average is 3.9, I think. We're kind of 5 point something. You know, our ambition should be to bring that down to below the national average. We can have a very quick impact on that by reducing maternal smoking. So it's not something that might necessarily take 10 years to achieve.
Is that because our maternal smoking numbers are higher than the national average?
Too many pregnant women are smoking.
Higher than the national average?
Yeah, and if we can tackle that.
There's immediately opportunity for targeting.
Yeah.
So within the 12 priorities we've identified, they are based on needs. So let's look at children best starting life. For example, oral health, we know we're red, we've been red for a long time. Infant mortality, we know we're red. But we think actually that will come down over the next couple of years, and it is more than maternal smoking. That is one of the key indicators. We also know childhood obesity, we've talked about that. That's another red area. So within each of those priorities, we've identified the red areas. And that is really for the Health and Wellbeing Board to discuss, okay, which of those red areas do we want to focus on? And like you say, what is a realistic target or ambition? Is it just to bring it in line? To get child obesity back in line with the national average would probably take a longer gestation time, I'd imagine, than just a year or 2 years. So it's really hard to quantify some of these. Even the national government struggles to put indicators on some of their targets because it's quite difficult. But I think it's a challenge. I think we need to do that. But we just need to be realistic about how long some of those changes will take. Oral health, for example, that's been one we've been for many, many years for Herefordshire. We benchmark poorly. Fluoridation would probably be the key thing to swing that round in my personal thing.
I'm just going to pick up on that particular appendix as well, climate change, but the actual picture is about air quality. So in terms of health impact, I would have thought air quality is the health impact of the areas with the APMA rather than climate change as the health impact.
So, yeah, I mean, air quality is a determinant of potential ill health in terms of respiratory disease and things like that. I mean, we don't particularly have many air quality management areas in Herefordshire. I think we have two, correct. But again, you know,
so that's not to say we shouldn't be monitoring other areas. I mean, I think air quality is potentially an issue.
It's probably more.
That's the health impact issue, problem areas. For me, that's how I would read that, is it's air quality.
Yeah.
Whereas what it says is climate change.
Okay. Is that in reference to the new?
But then it says that we've got 1.137 million tonnes of CO2 emissions in 2018. It's not totally clear what the health impact is there, but with 2 air quality management areas due to high levels of nitrogen dioxide in Hereford and Leominster. So the health impact seems to me to be air quality, not climate change. I don't know, it's just a thought. Do you want to come in next, Councillor Turner?
Yes, and not in the order that I was planning. So I shall think on my feet, so to speak. I mean, as has already been said, Appendix 2 is really, really useful because actually there's figures and there's percentages and things that we can measure. And I assume that by virtue of the fact that there are areas of concern, that they are levels or rates or figures or percentages where we are above national average. But certainly from our point of view, I would have thought it would have been really useful to see what those national averages are and to see how far we are outlying on those. Secondly, probably I'll be, everyone's had a go at you on Table 1, so I ought to have my share. But the bottom line is, with regard to Table 1, is that the new strategies, or whatever we're calling them, have to be so rigorous and in their measurement and data that in years to come, when this new strategy is reviewed, whoever is sitting around in whatever room they're sitting around don't face the same situation. It's as simple as that. Yeah. If the new strategy either can show no impact or the data is unclear, then we have singularly failed collectively in this new strategy. So by whatever means possible, we've got to make it more successful, more useful, more measurable. And the third point I'll make, the public consultation, which I'm sure everyone in this room has done, but I'll take this opportunity, if anyone's listening, to encourage them to do it. My only problem with it is it is a little bit motherhood and apple pie, which how important are all these various things. I found it very difficult not to put very important on all of them, in which and I appreciate there is then the sort of the final question which says, okay, if you could pick your top 3, but somehow it doesn't really drill down, and I think it would be understandable if people looked at it and did it and went, well, what is the point? Because it is all important, and maybe on consultations like that we should really be a bit more probing or a bit more detailed, or ask people to be a bit more specific, to really make it feel worthwhile for people taking part, but also in terms of what we glean from it.
Yeah, I did the consultation. I agree with you. It felt very box ticky. Yeah. Is it a statutory requirement?
No, it's not, and again, that's a fair challenge, and that's one of the concerns we've had, is that they all are important, aren't they? Yeah. But equally, we only have limited resources as a local system. So how do we prioritise? And I think we did try and identify, or ask people to identify the top 3. We did some work with the community partnership last week, a month ago. So there's actually some more qualitative data coming through, and obviously we're doing the Southern Herb groups as well, so doing a lot of deep dive. I think for me, it's not a statutory requirement as such, but I think for me, it's looking at the epidemiology, the data, it's looking at the surveys that have gone before and getting that qualitative perspective from the communities. And in a way, we can bring all that to the Health and Wellbeing Board. We can then make a decision about actually what is it we want to focus on. We're trying to hear the voices of the community. So it's just a real challenge to strike that balance, I think. And obviously getting the voice of those people we don't necessarily hear from, because they're the ones that are disproportionately affected. And they're the ones that are going prematurely compared to others in the county. So a fair challenge, but obviously as a board we can only bring that information together and just make sense of actually what we want to focus on as a board. It'll make the biggest difference.
Yes, I think it's quite difficult, that balance, because I would have thought the point is that you look at the JSNA, what we know. You take evidence on board and you draw from that. But then if you take on board consultation, particularly given the very specific groups that have been particularly approached, you might get a tilted bias or slightly, you know, a response that doesn't align with evidence or the JSNA, at which point you're going to be trying to, you know, get two ends to join. That's difficult, really. I mean, I think, you know, I think being evidence-led is probably the way to go. Because service users have a subjective experience of the service, and there's also everybody else that are not targeted. We're not particularly trying to get their view. You know, taxpayers, just people, general folk, men. We don't feel to ask them anything.
We have to get a law deal.
What men can do, fill in the survey. But I mean, just very slightly to come back, in the sense, kind of not emboldened by what the chair just said, but enriched by what the chair just said. Yeah, I mean, yeah, speaking as somebody who represents one of the most deprived wards in the county, and representing many people who are amongst the incredibly hard to get to in terms of their feedback. Certainly that survey does nothing that would encourage many of my residents to feel that they either could or would, or what's the point of, you know, completing that survey. And I fully appreciate it. It is very difficult, but yeah, I mean, somehow we need to make it more anecdotal, I guess, you know, evidence-led, you know, to get some examples of those things that are really mattering, yes, to some of the people who, you know, we most need to hear from. But I appreciate it's not easy.
It is a tricky balance. It's McAfee.
I mean, the points made are really relevant, and we've recognised them in the work we've been doing in the NHS as well to try and capture some of these issues that we've done since COVID. If there is a since COVID, it's still around, but more recently we've been doing much more outreach work to go out and get into communities. We've also recognised much more, if we're honest, the vital role that the voluntary community sector play in the contacts they have and the intelligence they can bring. So the integrated care partnership has much better contacts with the voluntary community sector than we've had in the past in the NHS side of things. And we recognise bringing the intelligence from GP practices as well. So what we're trying to do is take every possible opportunity to identify priorities for people and not just take the kind of the most heard voice. So the survey will be one voice, the JSNA will be another. The messages that Health Watch bring to us, that the JSNA, the voluntary community sector bring, GP practices tell us. Schools, we've got schools, you know, representatives from the partnership, social care providers, care home providers. There's a really big, rich range of people who can bring us intelligence that we can then factor in, so we don't get focused in on just one particular source of information.
Yeah, it's a balance, isn't it? We have Councillor Ironson.
Yes, thank you, Chair. Just really quickly, it says an easy read version of the survey will be made available. Do you have any idea when an easy read would be is going to be available? And there are 12 different groups of people here. Have they all countywide? Is it a good countywide consultation, or is it really city based?
Okay, so to your first question, I need to follow up on that. I'm not sure we did a full easy read version, but we have done a more simplified version that Impact Consultancy have done. So I'm happy to share that with you after the meeting. With regards to your second question, was that in reference to the focus groups that we're doing?
Yeah, the 12 different groups that have been consulted.
Yeah, I think they're variable across the county as a whole rather than Hereford City. Haven't got all the detail to hand, but yeah, they do cover most of the county. But obviously, it's not every single ward or parish, but there is a rural and urban split, I understand.
I mean, have you gone to food banks, for example, to?
I'm not sure that one is on the list, but again, we can happily add that. And again, we welcome input from the committee about other ideas about how we might want to engage those communities. So absolutely, I can add that one.
Parish councils might be worth engaging with.
We have gone through parish council in terms of talk community. We've gone through the LEP, change of commerce and others. There's various other kind of routes we've gone through.
Thank you.
Jane Ives.
I guess just a couple of reflections. I've been enjoying the discussion. I guess I think the point's been made around that sort of appendix 2. And it'd be really helpful to see the regional and national benchmarks against that. I mean, I certainly know for some of them are quite a long way away, and some of them I think in terms of smoking we're actually got lower smoking rates than the national benchmark. So I think that benchmarking is really helpful to see to help us prioritise, because I guess that's my second point, is that I'm really very keen that we attack a small number of priorities and really make a difference and shift the dial on them, rather than try and do everything, which I guess is probably a feature of the previous strategy. So that would certainly be from my point of view. The next thing is around the this notion of, so how do we get sort of lots of delivery groups underneath this? And we've none of us got resources to add in lots and lots of more infrastructure and projects and people to work on things. So we have to make use of what we've already got. And as Matt was saying, the Children's Young People's Board, it's there already. We need to use it to deliver this rather than have separate structures. And I think we've got quite a lot of really good stuff. The community partnership that's in place in Herefordshire is excellent. In terms of delivery, the work that we're doing through the One Herefordshire partnership, we need to make the priorities of the health and wellbeing the priorities of the health of our One Herefordshire partnership. So we're delivering against priority. So I think all of that is really feasible and possible, and I'm sure we can make more of a difference than has been made in the past. My very last point is around. I was recently seeing a draft document of I think it's called the Big Economic Plan. I think it's called, or the Big Plan for Herefordshire. And I think one of the things as part of that big economic plan needs to be a healthy population. And again, I think if we can align this with that big economic plan, it feels like we've got more chance of success by getting the things that we focus on, the things that we're all focusing on across all areas of what we're working on. But thanks, Matt, for all the work. It's great.
Councillor Summers?
Yeah. I would agree with what you've just said, especially on the focus. We seem to have a very wide focus on you can't get to everything, and it proves it as I mentioned it before, in table 1, where there are improvements in children, but everything else it's lacking. So to me that proves, and we know there's been more money thrown at children, we know there's been more emphasis on children, so therefore there's going to be some changes, whereas, so maybe we have to reduce that focus down to 2 or 3 definite areas and focus on that rather than go wholemeal over the whole. Anyway, that's just my feeling. Thank you.
I think that this kind of goes to scale, which we'll be talking about, you need to avoid goals like world peace.
I'd just like to come back on the second of the points that Jen Ives just made. This county it's above average age. There's an amazing number of people with skill sets that they've retired, but they've got time on their hands and they would really like to get embedded in doing things. I think we've got a workforce potentially out there, volunteer force, because we really don't appreciate just the quality and the breadth of some of those. How we harness those, how we bring them in, I think would be really useful to try to understand. I mean, I'm well aware that the leading epidemiologist in my world lives in the county. The head of the laboratory service lives in my county and retired, both of them. I mean, they're people with incredible knowledge, contacts, and we really do need to see whether we can harness the fact that we've got an older than average population. Well, can we use that older than average population? And we need to think what it is that they could do, because there's some of them that would be blooming useful.
Could I possibly take this opportunity to plug something called the NHS Reservist Programme, which is a properly structured programme where we have the opportunity for people to come forward and say, I would like to support the local NHS. I'm sure that we could promote and doing other grants as well. A bit like the kind of, the Army Reservists regime. Some of them are highly qualified people who've come back from retirement. Some are unqualified people who just want to make a difference. So if we could plug that and make sure that that's promoted, that would be helpful in the It's relatively recent.
Yeah, a very retired economist, and he gets called up from time to time. Yeah.
Thank you. I mean, it's something which I must admit I've never heard of, and I think that tells me something in itself. And I'm very mindful that a lot of people, of course, are concerned about insurance and cover and liability. But we saw during COVID how there were an extraordinary number of people who were able to assist during COVID, who with a little tiny bit of training were suddenly out there vaccinating us and doing the job. And it just struck me when we saw what we can do through COVID. That doesn't have to be wartime, we can do it in peacetime as well, so to speak.
And NHS Reservist was born out of
and that wants to have a breadth to it, that it doesn't put barriers in to those who were only NHS in their past. There are many who might well have a skill set that would act within the parameters that we're interested in, because they're not just NHS ones.
I think that's where probably, for me, a key part of this strategy will be developing the talk communities offer, growing social capital, growing our assets, utilising the voluntary sector and volunteers. So I think for me that has to be at the heart. You were talking about how you can help themselves. So I think you're absolutely right. I think that's something that I would like to see as part of the strategy, but obviously that's down to help being volunteer.
Can I just ask, the strategy approved in March 2023, is that Health and Wellbeing Board that approves the strategy and owns the strategy?
Sorry,
who owns the strategy?
The Health and Wellbeing Board owns the strategy.
Yeah, okay, so they'll approve that in March. And we, as members of the Health and Wellbeing Board, have a share of the ownership of the strategy.
That's correct, yeah.
Okay, all right. Can I turn to our cabinet member for executive comment?
Yeah, thank you, Chair. Sorry I was a bit late this morning, other things were happening. Strategies, my goodness, Councillor Toynbee hates that word because at every meeting you go to they mention some strategy or another, but this is a really important time. We're working well with the ICS, Health and Wellbeing Board, and there have been huge changes in all of that area, as we know, in the last 6, 12, even 24 months. So please be aware of that. We are working really hard. And I don't doubt that you don't know that already. The strategy consultation, I was really pleased to hear you mention that, Councillor Tillett, and you did complete it because you told me about the final question, which is like sometimes you think people fill in a consultation and they just tick, 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 and then it's like gone. But no, thank you for that. And I hope everybody else will endorse that and take it out to their parishes. I've mentioned it every time in my parish council meetings. This is the consultation of the month or the week or whatever. So really push it, please. If people don't have a voice, then they need to get out there and say what they think, because they can't come back to us and say, well, you didn't do this or you didn't do that. Did you take part? Yes, no. So yeah, please get it out there. I completely get your point, Councillor Ginman, about the KPIs. We often talk about key performance indicators and how we are doing with them. Are we doing them smartly? So every meeting that I go through, I talk about assessment, how do we plan it, how do we implement it, and then of course the evaluation is the end of it. So we really need to make sure those 4 steps are clear. The membership of the Health and Wellbeing Board has grown and has changed in this last couple of years, and I think it's been a really positive change. We've got much more partnership engagement, and the partners that we have really challenge everything as well, so that's a good working relationship. One of the things Councillor Ianson said was about the Solihull approach, and anything like that that you're not really sure of, tell us so that we can put either a link into it, or, you know, it's easy to look up. I'm not a huge computer buff, but even I could look up things that I don't really understand. So, you know, if you have a problem, come back to us. The Herefordshire Community Partnership has just gone through the strategies this week, and with the guidance of Health Watch and HVOS, that was really well attended, that meeting on Wednesday. So I thank them for their engagement. And again, that was a different set of partners coming to that. So I think we had about 70 people in the room, and I think there's a membership of about 100. So, you know, getting it out there, getting this consultation done is really important. Yes, the approval hopefully will be March 23, and then if that's the time that you want us to come back, I'm sure we'll oblige that. One thing that I will say to Jane Ives, and she knows I go on about this one as well, smoking cessation in pregnancy, and it makes me laugh when I see at time of delivery, because, you know, nobody's allowed to smoke when they're delivering a baby, so, you know, we don't advocate that. But when we had a dedicated smoking cessation midwife, our rates were really low. So I think, you know, as a board and as a partnership, we've got to look back at what's happened in the past and where we've got the results. And I think you've already alluded to those concerns anyway. Yeah, national average benchmarks would be great in Appendix 2. And if you've got any ideas that we can improve the strategy with, please let us know. You know, we're not in this on our own. You people here are really important as the committee. So feed back to us and let us if you've got any firm ideas. And I've also mentioned Councillor Tillett in his consultation. So that's it from me, but, you know, if you need anything, come to us.
Thank you, Councillor Coffey. Councillor Marsh.
Thank you. I think Appendix 2 would also greatly be improved by trend information, and, you know, we've been doing things like this since best value. You know, we know perfectly well we could do that. We could have the regional or our comparators and trend information. Also, I suggest we do monitor quite a number of things, even though we're not expecting to focus on them, because you're never quite sure when you might suddenly go, you know, something has got remarkably high and clearly does need some attention. And I was noticing that David's targets were lovely and neat, so get people with cancer through. And, you know, that is, it's a sort of manageable one, but our half of it is more, can we reduce the number of people? Can we have more healthy people so we don't need so many in going through your pathway, which of course will make that easier. And that seems to me that the ones about the most healthy years, or whatever the acronym is, are the ones that we should be focusing on. And when I came to my last three, I picked the ones that I thought were the kind of the most upstream, in the sense of, well, what might most help most people be most healthy. So yes, we could improve that. I mean, the priorities in Table 3 at the moment seem to me hopeless. I mean, they're just like everything. But I guess it's okay to go, yes, we would love all these things to be the case, but then we will have to have a bit where we unpack that and go, well, that's how it is. But this year we're focusing on getting a cessation midwife or whatever it is. And I was interested to hear about the JSNA, because that's still a statutory document, because I remember spending quite a lot of work on doing that in the past. And I suppose that is the document where we kind of go, well, how do we compare? What are the trends? And could you just update me on whether we're also doing where are we with JSNAs? Are we doing one of those as well, or is
Yeah, that's on my list to do, the JSNAs that sort of come into post. So I think we have a really good intelligence team here, and I said every 3 years they produce a summary JSNA, but in between that they do produce deep dives. So for example, just referencing the Children and People Partnership, on Monday I'm taking a 0 to 19s deep dive of all the health needs of our children and young people. I mean, it's about 150 slides, it's incredibly comprehensive. But I think we do need to look at the JSNA to make sure that it is actually useful and meaningful and drives decision making. Because I think sometimes we can produce these mammoth documents that just tell the world everything about Herefordshire. Actually, what are the recommendations, what things we want to focus on, and what we're going to change the results. So that's something I want to look at. I think the last JSNA summary document, I think it was possibly 2001, so it's been a couple of more. Pardon?
2021.
It was 2021.
Yeah. It's on here. Yeah.
So it'll be another 2 years, but I think again, some of the areas I've worked on, you can actually get some platforms that draw live data off national databases, and you can just go on it and it's automatically populated. So I think there's a bit of work to be done there. But as I said, whenever we commission service, I think that there needs to be a process. Actually, we do a needs assessment to inform that commissioning of that service. So the JSNA is kind of a high level summary, but we do deep dives, as and when needed, to kind of think about how we spend our money, if that makes sense. But I think we get to look at that and have a conversation.
That's good. And the last thing is that I kind of think you, in a way, gave us an easy and unnecessarily easy laugh, because it does say in 4.1, a detailed analysis was also undertaken on the key performance indicators. And then you've given us the one-page summary, which makes you look completely hopeless. And I think it would be helpful if you did do the detailed analysis, because I'm sure a great deal of good work has been done, and some things that would have gone wrong didn't go wrong, even if the trend was against you. So I do suggest that you make that from the document public, because, table 1 is not flattering.
Yeah, no, that's a fair point. I mean, there is a detailed spreadsheet that sits behind that, and I didn't want to necessarily share that with the committee. I thought that was a bit too much information. I think what I would like to do is, when we've done the strategy, there will be documents on the website that say, actually, this is the epidemiology of the needs, this is the results of the engagement, this is what people told us, this is what they said, and this is kind of actually so sort of a roadmap almost for the stages we went through, how we use that information, so it's just clear and transparent how we got to that kind of final document. So it's a fair challenge. I think for me it's just how much information I give the committee.
Sure. Yes.
I think public health has a reputation of just bombarding you with data.
Sure. And a spreadsheet like this where you can never get it's the worst. But I'm just saying that a short summary of some of the high points wouldn't come amiss. So.
Councillor Crocker.
Yeah, thank you again, Chair. The trouble is, if you have a short summary, there's always somebody who's going to say, what about?
Sure.
So, it's a fine line to get the information out there without bombarding everybody with everything. It was a bit remiss of me. I didn't even mention the public health team. They're a small team. And it seems like they're getting smaller every month. But, thankfully, we've got a director now who's really focused and challenging, and his team really work well with him. Again, I won't mention the B word, the budget. I have to, I suppose. That's always getting smaller and smaller. So, there's a huge amount of work that the public health team do that I don't think we all appreciate. And I think what we need to do as a membership, Matt, is get out there to all members, do some briefings. This is what the public health team are about. This is what we're looking at the moment. If you want anything else brought up, then just give us a nod.
I'll just come in on, and one of the things we've identified is sharing the good work that is going on. And one of the things we want to do is do a health wellbeing conference in March and actually produce a video that actually brings to life all the good things that are going on. So I think there is something about, again, this document doesn't probably do it justice, that there are some good things going on, but I would actually share that with everyone. Because like Councillor Crocker said, there is some good things going on. And we should be proud of it too.
No, I'd just like to go back to Appendix 2 as well and reflect on the fact that because of the once in 100-year event that happened during the period of the last few years, no matter how well we've done on some of these things, we wouldn't have been able to make a positive impact. Mental health, for example, has taken an absolute, people's mental health took an absolute hammering during the last 3 years. And we're at a stage now where we are really having to fight hard just to keep up, let alone the rest of the backlog. Waiting times for elective care in the NHS. We went from I think, single digit people waiting for more than 52 weeks to tens of thousands over a period of time. And it just takes time to catch up on those kind of things.
Understood.
So I think that's important. I just wanted to reflect on the cancer example as well that you talked about, because I think it is one of the best examples that we can use to demonstrate our new way of partnership working. So if we all focus on our own responsibilities, the NHS's responsibility is to enable people to access their GP quickly when they've got a concern. The trust's responsibility is to enable a quick referral from a GP, diagnostics, treatment to start, etc. Well, that's a long way. The risk of cancer we know starts in the home that a child is born into. The cancer in deprived areas is greater than, early smoking, poor diet, all of those things increase it. So if we can genuinely, as partners, go, the outcome, an avoidable death, early death from cancer is what we're trying to be better at. But we've all got a personal responsibility individually, not to smoke, to eat healthily, but also public health team and the investments they make in services, your housing services, etc. It's the one thing that we all have to work on together, and if any one part of it doesn't work, then we're not going to maximise the outcome. And that's what this integrated care philosophy is all about. It's getting everybody who can make a difference to a particular outcome for a population to get behind the same initiatives, to work together on it, to support each other, and to have the best impact that way. And I don't think we've done that particularly well historically, and I think there's a real opportunity for us to do it better now.
I think that's an interesting point. And actually one of the things about this, go back to the idea of resilience and helping people to help themselves, if you're talking about eating healthily, the kind of public health messaging is eat healthily, which translates as nothing to the average person. To eat healthy, so what does that mean? Oh, well, whatever. If you say eat more greens, you won't get cancer, then that kind of probably going to penetrate a little bit more. Stay off the sugary stuff or you get diabetes. These are the consequences. When we say, whereas healthy eating is a slightly fuzzy, concept. Cancer summons.
Yeah, hit on my favourite subject, of course, mental health or mental well-being. I'm just reading over Appendix 3, and we need to start reevaluating mental health more as mental well-being, which I know we're doing, which I'm quite happy about. Much of the mental health or mental well-being that we run into is actually stress-related, and I don't think we do enough or put enough information out there on stress and what it can cause. If you have 2 days of stress, that's not too bad. If you have 3-4 days of stress, it gets worse. If you have 2 weeks of stress, then you get into mental health issues. So I think there's room for more information on mental, because everybody's jumping on the mental health wagon at the moment. And it's not, there's mental health per se, which is a mental disease, and then there's stuff relating to mental well-being, which can gradually get worse and put you into depression. I think there needs to be more information out there on that, quite frankly. And the little blurb you've got there is quite good, but it doesn't quite. And we are going to mental well-being more so. I think we have to take the stress level. If you look at the figures for the council, for example, over a certain amount of years, there was 4,000 people off sick due to stress. So I think we need to really emphasize this stress thing, because everybody's going to go through stress. There's good stress and bad stress, but we don't seem to understand it. And automatically we say it's a mental health issue. It's not. It's just a well-being issue. Thank you.
Yeah, just on the response to that, and obviously there's chronic stress in early childhood and adversity, which is quite close to my heart. So I think it's a really valid point that we do need to shift and train mental well-being differently. And just to give the committee a bit of a heads up, no surprise, mental health and well-being is coming out really strong in the consultation and engagement. So it wouldn't surprise me if that's something that the board wants to consider.
I could probably just add a little bit to that as well. One of the initiatives from the new Act, the Health and Care Act, is the formation of something called collaboratives, which won't mean much to people, but essentially it's a new way of organising services. And we've put our weight behind a new one for the mental health collaborative, it's called, and it's changing the way in which we provide mental health services across the 2 counties. And one of the big things that's starting to be different is the recognition of mental well-being. So the spectrum of mental health, going from low-level mental well-being needs right through to very, very complex psychosis. And if we put all of our money in this end of it, we're going to have a huge problem
that's
here.
the problem.
So we've got to get the balance right.
Let's look at stress first.
Yeah, but it's not necessarily an NHS service that's the best thing to tackle what you're describing. It's how we work with big employers. It's how we work with schools. You know, so the focus of mental health will probably start over time to move more upstream, as people call it, to think about how we tackle it, but not necessarily by using registered mental health, you know, psychiatrists and psychologists, etc. And that's part of our thinking around.
Thank you. I'm going to wind this debate up now. So thank you all for your thoughts and your contributions. So the main themes that I was sort of picking up on, to start, we'd like to see the plan again once it's evolved a little bit more, the strategy. And I'd like to understand the relationship with other plans, and that we all have an understanding of delivery and implementation, monitoring and reporting. So it's more a package. Yeah, I think that's sort of it. So I think in terms of a recommendation, the suggestion is that the recommendation is that we see the plan again when it's more evolved in strategy, but that we have suggestions around the outcomes framework, how it relates to other plans, etc. Any other? Mr. Carr.
Chair, would it assist if I just read out a proposed draft for members?
Thank you.
I've noted down 5 key points which I wish to amend instantly, which would be noted in the first instance as the chair suggests as key conclusions that to be taken on board in the development of the new strategy, and then when it comes back to committee next year to re-look at that with a view to making recommendations to the cabinet if necessary. The first one is that the governance arrangements for the adoption of the joint health and wellbeing strategy and the delivery of the strategy be clearly defined. Second, that a delivery plan be produced for the new health and wellbeing strategy, which identifies responsibility for delivery of objectives of the strategy with clear measurable targets and timelines. Third, that the health and wellbeing strategy delivery plan be co-produced with key stakeholders and the community. Fourth, that the health and wellbeing strategy and the health and wellbeing delivery plan include meaningful and measurable key performance indicators, ensuring that these are framed around the availability of measurable data and outcomes. Fifth, that the draft health and wellbeing strategy be presented to the committee once available for review before it is approved by cabinet, to allow the committee to comment and make any recommendations to the cabinet and NHS Integrated Care Board.
Health and Wellbeing Board, wouldn't it be?
Possibly. That's a point of clarification. If it's going to the NHS, is it going to be signed off by the NHS?
So we're a partner in the Health and Wellbeing Board, so our role would be through that.
So, sorry, correction. So it would be cabinet and the Health and Wellbeing Board in that case.
Everyone.
Could we possibly add one about sort of welcoming as far as possible? I mean, I'm not saying you're not doing this now, but just as a sort of, you know, bed for it to sit on, the focus on prevention, maximum healthy years, and areas where we do have some, as our chair was saying, where we do have some control, that sort of influence. But I don't know if that's too wishy-washy, Michael.
But there's something around that, around the sort of this
but it's sort
setting the
sort of
ambition of the
direction.
strategy in a place where it can achieve things within our purview, within the purview of the
maybe we could welcome
care board.
Maybe we could start by welcoming the stress on prevention and commend, a focus
Yeah,
on.
prevention. Well, it is, I mean, it
and
is
commend the
number one,
focus.
isn't it? It's
Yeah.
to enable people to live a long and healthy life, basically.
Yeah, so we could
support them out themselves.
we can commend rather than recommend, and
Yeah.
as you say, the thing about things we can actually do something about.
Councillor Summers?
Is it possible, I started something about 6 years ago, was trying to work with the businesses in Herefordshire. Is it possible that you've new blood in here now, that we can get back to that about communicating with businesses to put in place self-help and all that kind of stuff, that we've got, or we can direct them. But I think the businesses really are quite lost until something happens. And we found that in COVID, and a number of businesses during COVID were lost, and some of them came to our meetings, which was useful for them. But if we can put something in place that we start highlighting about two things, businesses and schools, it's where we can get to people fairly easily on health, and we got them in one place, if you see what I mean, rather than trying to get the whole county. It's just something that we can focus on, businesses, making sure they have a healthy environment, and schools making sure they have a healthy environment. It's something I was working on about 6 years ago. And I think it's the way to go, to be frank.
Yeah, so that's why I'm working closely with the big economic plan that Jane and I have talked about. So in my view, I would like to probably put something to what you've just said. And again, I've worked in other areas where we've introduced healthy workplace charters, healthy workplace programs, and all down to capacity and resource again, that we just need to think about what we prioritise on. So,
Yeah.
Valid point. And same with schools, I think, again, it's a settings approach you've got.
But
Hopefully we see that in the plans.
if we can get to the businesses, for example, it's going to save us money, because the businesses are going to have to invest themselves, and we need to show them where they can invest. And if we show them where they can invest, it'll save money for us, is all I'm thinking. Anyway, thanks.
Thank you, thanks for that, okay. Right, good, is any of the officers, cabinet members, you wish to say anything else at this point? All right, so you've heard the suggestions, we're all happy with that, and we can take a vote from councillor Marshall.
Is there any way we can throw that last statement I made in there somewhere? I'm not sure how you would word it, that we need to start working with businesses for health. Because it is a priority. If we can get them on side, it's an easy, so I'm not sure how you can word it, but I think we need to be there.
But it involves a big economic plan as well, doesn't it?
Yeah.
Yeah, but it's,
big development.
That we support Mr Pearce's intention to work with businesses and schools. Maybe, yeah?
I mean, I think it's a really important point, because one of the things we talk about in the integrated care strategy is the fact that the health and social care system, if we think about domiciliary care providers, the whole of the NHS and social care, employs 5% of the people who live in our area. So we're a major employer in our own right, so we've got to do it right ourselves.
Yeah.
Then set the example for the other major employer.
Yeah, and okay, so we can also then include board partners.
Yeah.
In that, so businesses, schools, and partners on the health and wellbeing board. Because that's a lot of people.
It is, and we can have a massive impact. We have schools involved, say, in the integrated care partnership, and I know that the mental health collaborative has whether it's done it yet, but has a plan certainly to get out and engage with major employers, particularly as well around that. So it's definitely part of the agenda.
Well, I've got some stuff written
I
up.
think, I think it's in there, David. It's just, we're just trying to, find a way of expressing it in our suggestion, but it is happening anyway.
Whatever way you can put it, my words aren't that good, but I just,
No,
we want to be in the workplace and the schools, and you're in them.
Thank you.
Thank you. Just for clarification then, so I've got that the committee supports the intention to work with businesses and schools and other partners as key community stakeholders in the production and delivery of the strategy.
Okay, good, that's really good, thank you, all right, so please can I have a proposer and seconder for the motion. So it's Councillor Summers and the seconder, Councillor Tillett, all those in favour? Thank you. Thank you very much. All right, so moving right along, agenda item number 10, which is to receive the report on the impact of the intensive poultry industry on human health, which was a report that was done by the Task and Finish of the Scrutiny Committee and had been presented previously, the meeting prior to September, I can't remember that one, but that has come before us previously, and we debated it previously, so I'm not looking for another a reprise of that, but it has been tightened up and improved, and is now back for us to consider it for recommendation to the executive, and I would suggest at this point, if it's possible, to append or link through the previous minutes of the meeting where we had debated it, so this doesn't look as if it's just sort of unconnected with any debate. I mean, we will debate it today to an extent, but I'm not anticipating a repeat. But if we can link through to the previous minutes or include them in somehow, that would be useful, I think, for anyone trying to track the logical process that's happening here. So initially I'm going to invite Councillor Lissy Norman, who is with us virtually, to make an opening statement. Councillor Norman.
Thank you, Chair. So thanks for the opportunity to come back with this report, which we have, as you've said, revised to some extent. We took note of the comments made by members of the committee, and have thought it through, looked at what we're saying, and I think on the whole tightened up language as much as anything, so that what we're saying is clearer, more specific. In some instances it might have been rather vague. So I'm grateful to everyone who helped with that. I mean, the report itself was quite a lot of work, so we had input from officers who both supported us and advised us at different times, and of course we interviewed people, and so very grateful to them for their time, and people who sent in their thoughts and comments in response to the consultation that we did as well. A lot of people involved in this. I think given our revision, our looking at this, we haven't massively changed anything. It is more language. Particularly grateful to Councillor Ginman, who shared his concerns about the first report and who met with us to discuss possible changes. So I hope we've met the concerns that there were. And it's been better worded, I think, thanks particularly to Michael Carr, who helped us with that. Better worded, it's tighter. The recommendations, I think, are clearer and more specific, but no massive changes. We did not find evidence of harm. Remind ourselves what we're looking at, the impact of the intensive poultry industry on human health and well-being. And at this point, it's probably worth thanking Councillor Ginman for a particular phrase he used, One Health, how interlinked the health of people, animals and the environment are. I think that's a really important element within everything we're discussing. And certainly we go along with that. That seems to make a lot of sense. So we didn't find evidence of harm, but we became aware of anecdotal stories and experiences that indicate that there may be harm to health and well-being. There's certainly anxiety, concern. The reference in the last discussion about how important not to mix up mental health and stress, for example, is quite important when we talk about language. And it's clear that the whole thing causes a great deal of stress to people, but we perhaps use the phrase mental health inadvisedly. So we've made some revisions in that respect. What we particularly found was that there's clearly a need for more research and evidence. It simply wasn't available, and that's in particularly referring to locally, because there's masses of stuff out there. We came across reports, huge number of reports, but nothing specific to our particular area. So that's where what our recommendations reflect is, in particular, is the need for far more monitoring, and you know, a need for this research to be done. It simply doesn't seem to be there. So I hope, I won't go on and on, but I hope we can convey to the public that we take these matters seriously, and to reassure them that all necessary steps can be taken, obviously taking account of the fact that we don't have all the answers and we don't have the resources, and it's not our responsibility to do everything. But our recommendations are, I hope, sort of pointing towards where we feel that responsibility ought to be taken. So I think I'll leave it at that, and happy to listen to the committee and perhaps answer questions if needed.
Thank you very much, Councillor Norman. There's something that I think the committee is aware of, and so I'm going to mention it because I know we're aware of it, and it actually goes to show that the questions raised by this piece of work are, you know, we're not unique in looking at these things, and that there are, you know, more data, more understanding would be useful. So that there was a report recently, it was in the press, and certainly it's been circulated quite a lot locally, about superbugs in the rivers, and that report is by the Alliance to Save Our Antibiotics and World Animal Protection. But I'm also grateful to Councillor Ginman, who found a very good response from RUMA, which is Responsible Use of Medicines in Agriculture. So it's important that we understand both sides of this and that we see it in a balanced way. But I think that it goes to show actually that this is a live topic. It's something that people are concerned about, and that there is really the need for more data and better understanding in some of these areas. I think we could all agree that, and I think in a sense that's sort of the main thing that I take out of this task and finish. Is that we don't know enough about these things, particularly in a local context. I'm not certain, so I'm asking for some help here. Recommendation number 5, monitoring and abatement equipment and techniques. When we discussed this previously, I think that the suggestion had been made that it would be helpful for the council planners, residents, applicants and everybody if we had some sense monitoring, as it were, on the ground of what you get when you get an odour modelling report. With an application, you'll get an odour modelling report, which an expert will tell you that you won't smoke one. But often people, the public or people who are objecting to applications simply don't trust that report, because we don't have a great deal of sense checking on the ground. So I think it would benefit applicants and the council and residents and everybody to say, right, on this application, the odour modelling report said whatever. We've gone out and we've put equipment around this and we've tested for ammonia, we've tested it, and we have proven that that was correct. It puts a degree of confidence into the system, which I think is not there. Now, whether that suggestion is adequately expressed in recommendation number 5 is the question I'm asking Mr. Cobb. I could ask somebody else, I don't know.
I think, first of all, I would say that the main body of work for the task and feature group has been discussed within the task and feature group, and it is quite difficult to comment at this stage for myself. I think if members wish to add to amend that, they can do.
Okay, so we might add another recommendation.
They may wish to ask witnesses here today, public health, if they have that.
Chair, would Mark Willimont possibly have
that would be great.
a thought on that?
Oh, hello. Hello, Mr. Willimont.
Hello there. Yeah, I've been listening in. I've been in the background. I haven't been catching up on my emails on the earlier part of the agenda. I do apologise in advance. But yeah, no, I pricked up my ears to this part. Thank you. It's something, so I know that myself and Councillor Swinglehurst worked very closely on IPUs in the past and in different sorts of ways. So I think recommendation 5, that concerns, isn't it? That's the potential lack of monitoring, isn't it? And abatement on IPUs, intensive poultry rearing units. I was just trying to flick up to see the actual wording of it.
It's not asking for DEFRA to do something, but I'm suggesting that we could work with the industry.
Well, Yeah, what happens at the moment is, you know, every poultry unit that has over 40,000 birds, which is the majority, I suppose, in Herefordshire, they will be operating under an environmental permit granted by the Environment Agency, regulated by the Environment Agency. The interesting thing is that although there are certain standards in that permit about dust levels that can be permitted, there's no requirement to monitor, to check that actually happens. There's no actual abatement equipment to ensure that dust or anything else is reduced as it comes out. So basically it seems to me to be, and to others, to be like a standard license permit, which essentially permits that sort of industry to emit things out of its fans. Whether they have an impact on human health or not, we don't know, because that work hasn't been done. So I suppose it was to ask the government to say, well, bearing in mind these have been permitted now for, is it 15 or even 20 years, has not the state of the art moved on, and should we not be asking for some form of filtration or abatement plant on the fans? Has that not moved on? And as you say, Councillor Swinglehurst, it could lead on to other sort of work being done by universities or agencies to see what actually does come out of these units. And, you know, it would be interesting to put agar dishes out distances away to see what pathogenic spores and bacteria might grow on them, and also the dust levels, etc. Because at the moment we're working fairly blind on this. All we have is health statistics, which doesn't seem to show any cluster. But you know, it would be interesting to know what actually is airborne around these areas, particularly those where you could be said to have a cumulative impact of many IPUs in one area, and you could be the house that is in the centre of it all. So that was the thinking there, but the wording, of course, can be, you know, adjusted, can't it?
No, I understand what you're saying, and so I think probably what I would be suggesting is that there is an additional recommendation from this committee, which would be to work with the industry on a voluntary basis to put some monitoring equipment in order to sense check on the ground the odour modelling that came in with the planning, because there's a credibility issue with residents and objectors as they read a report about something and it's as though you know they have very little confidence in that. Whereas if you can say we've sense checked any number of these installations against what it had said on the odour modelling report, and proven that the modelling reports are sound, then I think that would give confidence to everybody really.
Yeah, if I could come in again, I think that's an interesting point, because when I was working very closely with the planners, I do remember we checked the cumulative impact aspect of the odour assessment on one of the more contentious applications particularly. It was difficult to find actually an expert that would do it, because there are only a few in the country and they all seem to work closely together, and nobody really wanted to peer review anybody else's work. So it's an area where it is questionable. I mean, we did find somebody in this case, and it actually did show that the odour assessment and modelling work was accurate, the variables, etc., were correct. But again, all these things, and I suppose my point I was trying to make at the beginning, it's all an assessment, it's modelling of what we think is happening, but no one's actually going out. And you know, and odour doesn't necessarily cause health. It's potentially more the dust, isn't it, or spores, I suppose, that from a human health risk would be the things of interest.
But that's exactly the point. If you go to another consultant, then they will use the same variables and the same numbers, and they'll crunch it all the same and come to the same outcome. What you want to know on the ground, what's actually happened in reality, and if the model is correct or not, and that's never been done. And I think it would give colossal confidence if you could say, right, we've gone out and we've checked, and what it said on the odour modelling for this application is indeed correct, or indeed the particulate modelling or anything else, and that's to everybody's benefit, isn't it? Really, I would have thought so. So that would be the recommendation, is that we try to work with existing IPUs, the industry, for them to be able to demonstrate that the modelling is correct or not. And that's so that if we can kind of capture that concept, if we're happy with that as a little addendum, that would be fine. So Councillor Ironson, how do you hand up and break down? Oh, there we go. Councillor Ironson.
Yeah, sorry, my hand disappeared. Just it sort of connects to recommendation 8 in a way with when he talks about myth busting.
Yes.
Doesn't it?
Yeah, yeah. So it's just slightly extending, I think, where we're at with recommendations. It seems to me to be a logical extension there. Yeah, Councillor Marsh.
I was just thinking that there are a lot of people who do use their noses for a living. I'm not suggesting that we get a highly skilled wine taster, but to be truthful, to check smell, we could do with someone smelling it.
Go and breathe, yeah.
Would possibly be good. So another welcome having an additional recommendation from the committee. And I'm just looking at paragraph 30 on, I forgot which page we're on, but we're on page, anyway, paragraph 30, which is all about, we have a draft recommendation there about a health impact supplementary planning document. But I'm just aware that planning really is a service that the council do deliver. And I'm aware that in paragraph 31, it suggests that public health should be consulted. Oh, hang on, wait a minute. Something about, oh yes, yes, in paragraph 30, plan envisage that health will be an embedded thread through the local plan. And I wondered if we, might perhaps just express definite support for that, because that is slightly different from a supplementary planning document.
Yep.
And there was, in 31, I'm just trying to work out that whether we definitely ask for, here we are, yes, at 32, we're suggesting health impact assessments that might feed into issues such as IPU, large IPU developments, and I'm not quite sure, Matt, whether you are ever consulted, but again, that might be something the committee might
That was
like
something that came up in the when we were discussing about the obesity
Yeah.
strategy as well, health impact assessment.
Yeah.
So this seems to be a
perhaps we might just
a very what will probably prove to be a very useful tool for planners.
because yes, I'm aware that our recommendation is very wide ranging, and this does have the benefit that we are the planning authority.
Well, no, exactly. It's sort of it's kind of trying to do what can you do, what's within our purview and within our gift, rather than recommendations that are not. But there's no harm in them, but they're not within our gift. So I do welcome the health impact SPD, or indeed that how that might work in terms of where we're also looking at it for obesity, that it becomes a material consideration in the planning balance, and that seems to me to be a very reasonable, sensible thing to do. So, have you got any further comments, Pierce, you'd like to make on this report?
I don't have any comments. I know Dr. Frances Harry's joined us as well, so I don't know if she wants to comment at all.
Oh, yes,
Oh, everyone's here.
everyone's here. Hello, Dr. Harry.
Sorry, I'm in two places at once today, but Matt's helpfully brought me in at the right time. No, I don't think there's anything to add. I mean, I think, I was hugely pleased that this work was going ahead, and really recognise the amount of time and attention that it was given by elected members. And I think we've got some really workable recommendations. So I'm pleased at where it got to. And I think that we will be able to move forward on implementing those recommendations. Just picking up that point about the health impact assessment and the toolkit, we're beginning preliminary work on that, and to agree with the director that I think that's something that we will bring health consideration into quite a bit of the decision making of the council. I think that can only be a good thing for the health of the local people.
Very much so. I think that'd be very useful. Thank you very much, Dr. Harry. Okay, any further comments at this stage from members of the committee? No? Officers? No. Oh, Councillor Summers?
Yeah, it's me again. I'm just concerned about, I'm looking for it, the units that are already in that should be upgraded. I don't see it. If we don't get those upgraded, we don't put something in about those, there's more harm coming out of those possibly than the more modern ones where we've gone over the planning one, yes, which is good. but those ones that are previous older, a couple of years older, that haven't got the up-to-date equipment, what do we have anything in there? But I can't find it, I may be wrong. I mentioned it at before. I'm not sure where we are on it. I don't see it, but I think it's a big concern because it's been going on for many years, so there are some units there that probably don't conform to new regulations. Any business you're in, or if you do upgrade, and my son's upgrading his optics every year. If he doesn't get a license. So that's my concern, is the stuff that's already being built and has not been changed. Thank you.
Could I say that there's quite a bit about that in a freedom of information request to the Environment Agency. There were a number of questions put to them, pressing them about the process for pushing for updates. I can't quite remember which.
Okay, so what
appendix
were we
it
talking
is.
about? So retrofitting of units with best
But
available.
basically, when people do want to retrofit them, they come to planning, but the process of pressure being put on people to upgrade is firmly within the purview of the Environment Agency. And as I say, there is some
Okay, so
information
maybe
in the appendix.
can we fashion a recommendation around that to
retrofit?
But yeah, for the executive to engage with the Environment Agency to ensure wherever possible best available techniques are employed in retrospective refits or whatever.
No, I did raise that matter with Abro. What was it, Ab?
Oh, Mr. Willimon.
Isn't that recommendation 5 already, though, Councillor
Swinglehurst?
Isn't that what we're trying to say? Because I think what Councillor Summers is saying, I mean, particularly ammonia, and Councillor Marsh is correct, when some of the new bigger IPOs are replaced, the only way that they can get over the hurdle of Natural England and Environment Agency objection is to put in some form of filtration abatement to take ammonia out. Just to add that the ammonia concern is to protect the ecosystem, not human health, but all the same, it's something that can happen because of an upgrading. And I think what recommendation 5 is saying is that, hasn't the state of the art moved on that maybe all of these units should have some form of ammonia abatement in and perhaps particulate abatement in. So I thought it's there already, but perhaps rather than put a new recommendation, you could reword that if there's any sort of ambiguity.
It's whether or not it's covering existing units, recommendation 5. So the retrofitting of existing units.
I thought it did, but let's just have a look at it
Advice
again.
and guidance on the best available techniques now available for IPUs, pollution monitoring and abatement and equipment for both ammonia and particulates, both within the county and nationally.
To me, that's both old and new.
Yeah. If we just insert after available for existing and new, that covers that off, doesn't it? It just makes it just completely clear. How about that?
Yeah.
Yeah? You reckon? So now available for existing and new intensive poultry units.
Chair, I think if the committee wishes to make that amendment to the report, it can. I would tend to concur that the existing wording need does apply universally, but if you want to emphasise that point,
well,
you can.
Has anyone else got any views on that? Do we need to spell it out, or do we take it as the implication is existing and new?
Well, yeah, just quickly, thank you. I think that was the intention, as we've heard, but I'm really keen that we do tighten it up as much as possible. So I personally would be very happy with a few extra words to make sure we don't lose that specific element of it. I think we know what we intended.
I can see your intention, so that it is just making it really, really clear.
I would welcome that.
So that there's no misunderstanding around that, if that's okay.
It could say review and implement. That would be the very shortest way of doing it.
Review and implement. Yes. Review the advice suggests that you would be advising it differently. Review and implement, is that what we were actually endeavouring towards? Yeah. Yeah, this is just tweaking this, but it's quite an important recommendation and we want to get it.
It is, yeah.
Bang on, or, you know.
I mean, it wouldn't hurt to put the point about retrofit in, because then you can't miss it. It's absolutely clear.
That's the terminology.
But if you use existing and new, then that
They use
covers everything, doesn't
retrofit.
it?
It's a good terminology because most of them need retrofitting nowadays, or many of them do. Now, Avra said they would recommend that to the people they deal with. Well, whether they do or not, I don't know. But if it's in there, retrofit older units, then it's.
Well, I do think that's covered if we just say existing and new, and that pretty much covers it. I'll say everything. That's all things all together. So okay, it's just a tweak, isn't it? But it just gets a little bit more.
By virtue of the fact that a great many of us have read it and have come to slightly different conclusions about what it means, suggests that it wouldn't hurt to tighten it up.
Just tightens it, just a tiny teeny bit, and I think that's helpful. Okay, good. Has anybody got any other further comments on that? All right, okay. In which case, we need to.
Just to verify your point. That's why.
Okay, let me yeah, I think that's brilliant.
So we've got that and these two.
Yeah, and then tweaking that. Yeah, okay. So so I'll pass over to Mr. Carl to share the outcome.
On behalf of the chair, the motion is from the report.
Sorry.
Oh, sorry.
Mr. Wilmot, did you want to come in?
Yeah, please, just to clarify, because we'll probably be asked, because from here the recommendations go to a cabinet member, don't they? So recommendation 8, that's the antimicrobial resistance antibiotics one, is a report to be prepared. Is it saying that the local authority prepares that report, or does it say we will work to lobby others to prepare that report? Just that could be a very large piece of work, or it could be just a literature review trawl of what's out there. I don't. Should we try to, what exactly do we mean by that? Because I know what the intention is, but there's also a resource implication that the cabinet member will have to consider if we do it.
I take that as being a compendium of what we know. Is what? I'm sorry, Mr. Okay. All right. So, Councillor Norman, have you got any?
No, what in that particular one? Well, yes. I mean, I think this. I'm not sure who's going to be doing it. I'm afraid we haven't pinned that down. It's clear, but I think it's very important that we do produce something along these lines, and it'll anticipate quite a lot of the issues which come up. In some cases, it'll allay some of the concerns. Yes, I think it's important. I mean, does Mark think it's something that we can do? I appreciate the resources issue.
I think it's the scale of what is being asked that Mr. Wilmot is trying to pin down. And it would have been my understanding that what this would be was, as you describe, a kind of pulling together of existing what is known, and not a lengthy tome at all, but just addressing those very common concerns. So if it was, the one about antimicrobial resistance, that could take something or put a link through to the website of the responsible use of medicines in agriculture as a source. I think we can draw on other existing things. I don't think we're expected to actually come up with all the answers, only.
No, I agree with that. I think that makes sense. It's what we can pull together, something that's clear, various things in one place. And then, as you say, there could be links to find out further information if needed.
My understanding is that this is a sort of short document for the public, and quite like what was in recommendation 7. So maybe it should just say short.
Yeah.
Or simple,
short.
Pithy.
Or in fact, you could just finish it at the word concerns. I think where it gets difficult is because it starts to talk about a whole subject. Let's say it's a fact-checking, myth-busting document tackling common misconceptions about common public health concerns.
and because it's
related to the intensive poultry industry.
It's under public health information.
So then it would probably fall under public health.
Because yes, the heading at 56 is public health information. So yes, it needs to be clearly understandable to an ordinary person and approachable in name.
And is this something, sorry to interrupt again, Francis, would presumably you would contribute to this as well to some extent?
Yes, I think with the word summary, short, and pacing, I think we can
a brief summary, a haiku.
Yeah, so just if I may comment on this, I think the industry would actually be quite glad if some of the common misconceptions were removed. I mean, the idea that there's extensive use is a bit 1960s rather than 2022. So I think having the opportunity to explain and the complexity of looking at resistance and the relationships between hospital use, agricultural use, etc., and the upsurge in concerns, quite rightly. The industry itself is incredibly concerned about being able to use antimicrobials in a proper way and a responsible way. The fact that you can dig up ice embedded carcasses from many moons ago, centuries ago, and find the genes and indeed bugs that carry resistance shows that the subject itself is incredibly complicated. So I wish you luck with your simplification. I'm very happy to try and assist in that regard. I think it is important we understand the crucial importance of antibiotic usage or antimicrobial. Go further, that antimicrobial is not just antibiotic. Let's be absolutely clear, it's broader than that. So it's absolutely crucial we understand the role of it. I always get concerned that people go, oh, well, we can vaccinate. Just be aware there is now vaccine resistance. So the whole entity of how you control disease is not a simple one, and simplifying it sometimes can lead to even more questions. But good luck, happy to help.
Thank you.
But yes, a difficult subject.
Yeah, it is. But thank you for your input and your offer of help, and that's very welcome. Right, so back to
So these amendments need to redact that and then
yes.
Right, so the new motion is that the reports and recommendations on the impact of the intensive poultry industry on human health and well-being, Appendix A, be adopted subject to the amendment of recommendation 5 to insert and implement after the word review, and to insert existing and new before the words intensive poultry units, and the amendment of recommendation 8 to insert the word summary before the word document, and to remove the words such as antimicrobial resistance and the use of antibiotics in intensive poultry farming. That the council work with the industry on the assessment of dust and odour emitted near intensive poultry units to assess and verify if the modelling of emissions is confirmed from experience, and that the report be referred to Cabinet for consideration and executive response.
Great. Thank you, that works for me, thank you. Yep, okay, so, does Cabinet Member, Council Officers or other participants wish to comment before I put that to the vote? No, okay, good, thank you. And I'm just going to pause momentarily to thank the Task and Finish members who served on the Task and Finish, officers who supported them. Because this was quite a difficult thing to do. I think, you know, I'd like to thank them for their time, effort, expertise, everything that they put into it. It's a good thing to have done. And particularly I'd like to thank those members of the public who came forward and shared their lived experience with the Task and Finish group. So that being said, can I have a proposer and a seconder for the motion as read by Mr. Carr? Proposer. Councillor Marsh, and the seconder, Councillor Tillett. All those in favour, please show. Thank you. Thank you. Thank you very much, everyone who's attended for that item.
And thank you to our chair for really championing this as part of the wider determinants of health, and indeed championing, including the experts by experience, because it is, yeah, it's been good to do it.
Well, I think, yeah, it's, you know, the more you understand them, the better, isn't it? So, it's good, it's good. Well, I think, yeah, it's important, isn't it? Something that's important to our residents, it's important to show that we're paying attention, that we do care, and that we've looked into it. And now the Cabinet can mull it over, so that's great. Okay, so we'll go up to agenda item number 11. That's on, skipped a bit.
I'm going to leave now. Thank you. Okay.
Oh, fair enough. Cheerio. Thank you for joining us. I haven't seen Mr. Whitmore for ages. Anyway, right, so
thank you.
agenda item number 11, dates for the next meeting, which appears to be the 23rd of January 2023 at 10 AM. So there we go. At that point, I will finish this meeting. We can switch off the live feed, please. Thank you.
Can I just say thank you